Hello there, I'm Rocky Paul Canivel, a junior radiologic student of LaGuardia Community College. Today I'm going to talk about calcaneal spur. The patient came in due to pain in right ankle and installation of hardware. The patient is a 74 years old male, hypersthenic, and brought in a stretcher to the room. The protocol of the site for the X-rays of the ankle are AP, lateral, and Mortis views. I did the lateral view first to the patient as his right foot is already positioned for the lateral. Then I asked the patient if he can move backwards for the AP and Mortis views, which he did. The patient cooperated in the procedures and I gave the correct instructions for each radiographic position. I have optimal images for the three views with the use of 65 kVp and 6 mass. After the procedure, I gave the patient a blanket for warmth as he asked for it, and I brought the patient to the transport area after the procedures. Here is the report for this case. There are three views made for this X-ray case. However, the lateral view is the only one to be focused for this presentation as the calcaneal spur is prominent in this view. For the positioning of this lateral view, the distal one-third of tibia and fibula, talus, calcaneus, navicular, and tuberosity of fifth metatarsal are in profile. Cuboid is partially showing up, which is good. However, the patient's right leg is partially high as the talar domes are not parallel as the other one is going superior and the other is inferior. This also partially blocks the ankle joint. It is not a perfect radiograph but an acceptable radiograph. The red arrow points to the calcaneal spur. The calcaneal spur is the pathology found on this case. Calcaneal spur, sometimes called heel spur syndrome, is a bony outgrowth built up by tiny calcium deposits that can be found in the underside of the foot. It can be sometimes confused with plantar fasciitis, but the difference is that calcaneal spur is a bony protrusion or a bone bump, while plantar fasciitis is swelling of the thick band of tissues that run from your toes to the heel of your foot. On this lateral view of the ankle, you can see a calcaneal spur in the posterior inferior part of the foot. You can see how it grows from the heel of the foot with a pointy end. The calcaneal spur looks like an extra bone because it is made up of calcium deposits that has been built up on the heel. Looking on this image, I see that the bone spur is only in the inferior part of calcaneus. In some instances, there is a spur in the back of the heel of the foot and that is connected with the inflammation and swelling of the tendon there, which is the Achilles tendon. Here are two pictures of my patient with calcaneal spur and another radiograph with calcaneal spur inferior to calcaneus and one in Achilles tendon. As I told earlier, the patient is hypersthenic. The calcaneal spur is prevalent among older people that are obese and has previous trauma on the ankle. The impression of the radiologist is that the patient has sclerosis and there is deformity on the ankle consistent with previous trauma and the patient has calcaneal spur. The factors of overweight and previous trauma in the ankle resulted in the calcaneal spur. Also with increasing age, the bundles of tissues of the plantar fascia that runs underneath the foot decreases in flexibility, which thins the heel's protective fat pad. As the fat pad decreases, it aggravates the tissues of plantar fascia underneath, which develops the growth of tiny calcium deposits on the heel, which is the calcaneus spur. Now, besides for older people, calcaneal spur can happen to regular adults. This happens in people like athletes because of doing Outside activities such as running and jumping, also wearing tight shoes that don't fit will result to calcaneal spur. Okay, let's try to wear these shoes. It's, doesn't fit well. Oh, damn, it hurts. Oh, there are many ways to treat heel spur. For non-surgical procedures, use night splints, shoe inserts or orthotic device, over-the-counter medicine like Advil for pain relief, and also doing stretching exercises. For a surgical treatment, patient undergoes plantar fasciotomy and heel spur resection wherein the plantar fascia will be cut to remove the tension in the tissues and prevent the risk of building up calcaneal spur again, and the calcaneal spur will be removed from the heel. A person can prevent heel spur by wearing well-fitted shoes with absorbent soles, warming up before doing any physical activity, and pacing gradually for each strenuous activity. For overweight, reducing weight will help prevent calcaneal spur. Thank you for listening to my presentation. I hope you like it.